how are you incorporating, diet modifications in here? Are you doing any specific foods, or are you cutting out foods? Or are you looking for problem foods?
Yeah, so again, a thorough history. I like to start with basics and take baby steps, especially with parents working with kids. I mean, some of these kids, especially kids that have autism, they have a tough time with foods, texture, taste, and such. So you have to take baby steps. But even adults, you do. So let's start first by looking at what we're putting in our mouth on a daily basis in terms of our meals, our snacks, our beverages. Let's start to at least clean it up. Find healthier versions or alternatives to what you're already eating that could be toxic or full of artificial sweeteners. And that is one topic I talk right off the bat, is you need to immediately get off artificial sweeteners. I mean, that has been proven a long time ago, but again, the general population does not know this. So many people consuming these things, especially in their beverages. Look at the energy drink market. I mean, it's a huge market. We get kids that are 2-3 years old drinking this crap. It is so toxic to the brain, but yet we still allow it, and this industry makes a lot of money off the suffering. Anyway, so we start with some basics. Now, of course, through our functional medicine laboratory testing, I like to do IgG food sensitivity tests. So now we can get more specific to that person's needs. So we'll look to see what their immune system is responding or reacting to, and to what degree. And of course, once we know that information, then yeah, we're talking an elimination diet, not for a lifetime, at least 6 months, until the brain and body recovers and they're feeling better. And then we start to reintroduce those foods slowly, or just reorder the IgG food sensitivity to see how the immune system is responding at that point. But that's ultimately the best way to go. But not everybody can do all this at one time. So we take baby steps. And I do have online platforms that give people coaching and guidance along with what I do on a personal one-to-one basis.
Yeah, I think when people talk about food and they talk about diets, and people obsess about calories and macros, but I really think that the biggest changes come when you focus on ingredients. Of course, you have a lot of studies that tie these food dyes to behavioral problems in children. So yeah, I think that's a great solution.
Yeah, most definitely. Yeah. And again, like you mentioned, I use that analogy oftentimes. I mean, stick to the perimeter of the grocery store and you're usually doing pretty well. Even then, you still want to read the labels. And basically, the more ingredients you see on the label, especially when you start seeing these long, complex chemical names, stay away from it. We shouldn't have any more than maybe a half dozen ingredients in most products. Keep them whole food. And then from that step, then the next logical step would be to try to make these foods organic whenever possible as well. And I really have come to learn that importance too, because of, again, the toxicity tests, because we look at the level of organophosphates, which is primary sources from herbicides and pesticides, which are used routinely on our crops, the veggies that we're eating, and the fruits, and what goes into our different processed foods. So again, take person step at a time. So start with the basics. Let's clean it up, remove the toxic ingredients, start with the big things like the artificial sweeteners. All right, now that you've got that and you feel good about that, maybe you're already starting to feeling better. Let's now look at, can we start to replace this stuff? Take a little extra your weekly paycheck and start investing in organic foods. Let's take it to the next level. Yeah.